Hello and welcome to Med4 Care. I am Dr. Care and today's topic is halitosis. Halitosis is a condition in which a bad breath is emitted from one's mouth, which is perceived as unpleasant by other people and can create a serious social problem for the patient, who very often doesn't realize that he has this disorder. It has an estimated prevalence of around 50%. It can affect 1 out of 2. There are 2 different types of halitosis: real halitosis, in which the patient really emits an unpleasant odor from his mouth, and imaginary halitosis, in which the patient is convinced that he's producing bad breath from the mouth, but this is not proven by the doctor or by specific tests. This type of bad breath is often caused by states of anxiety. Let's see what the causes of real halitosis can be. Bad breath is caused in most cases by an alteration in the oral cavity, while more rarely causes of extraoral origin may be present. The substances responsible for the bad smell of the breath are generally chemical compounds containing sulfur. For example, the consumption of garlic and onion feeds bad breath since these plants release molecules containing sulfur, which remain for a long time even after digestion. Almost 90% of cases of halitosis are due to diseases of the oral cavity, such as gingivitis and periodontitis. Dental caries and depressions between one tooth and another can also cause the accumulation of food debris, which degrades over time and emits bad odors. Rarer oral causes of halitosis are represented by tumors that can affect the tongue, salivary glands, or soft tissues of the cheeks. For the extraoral causes of halitosis, these can have the following origins: gastrointestinal, such as in the case of gastric reflux, respiratory, pharmacological, systemic or metabolic. In case of halitosis, it's necessary to resort to a medical examination. During the specialist visit, the patient will initially be asked some questions, to understand, for example, if he has particular vices such as smoking and alcohol, if he respects his oral hygiene, or if he suffers from respiratory or digestive system diseases. After investigating the general state of health, the doctor can determine the origin of the bad breath, if it is therefore caused by intraoral or extraoral problems. In both cases, a physical examination of the oral cavity, or of the respiratory system or digestive system, is done for signs of inflammation or infection. In case of a diagnosis of halitosis, specific instrumental tests may be required to better understand the quality of the breath emitted. Let's see what the treatments and remedies for bad breath can be. The intraoral causes of bad breath are the main source of halitosis, and it's necessary to intervene by improving dental hygiene. It's advisable to free the lingual biofilm. The biofilm is a patina that is formed on the tongue by bacteria and other microorganisms that ferment the food debris trapped in the oral cavity. Using the proper toothbrush, dental floss, and a scraper, you can effectively release the biofilm. It's also recommended to use special mouthwashes. Rinsing the mouth with antibacterial solutions can certainly improve the state of oral hygiene and reduce bad odor. Finally, it's possible to prevent bad breath by avoiding foods such as alcohol, spices, garlic, and onion. For extraoral disorders involving halitosis, these must be treated according to the disease that causes bad breath, using antibiotics or surgery. We are now at the end of today's video. We hope you enjoyed it. If you found it useful, please support us with a nice like and subscribe to the channel. See you soon on Med4 Care.